I'm going to begin again by just welcoming people to the webinar, which is an early preview of our report, Built to Harm, which is embargoed until Wednesday. This event's being recorded. And just to say, I think it's quite timely that this is also day 7 of the United Nations Women's 16 Days of Activism Against Gender-Based Violence. And we very much link deaths of women in prison as a form of state violence against women. It's also clear by the interest in this online seminar that this is an area of acute interest and concern, and it's really good to have so many people representing a diversity of experiences, including those with personal experience of the shocking reality of prisons and the harm and devastation that it causes. Although this report focuses on England and Wales, this is an issue that cuts across the UK, and we also work closely with others on these issues across the globe. My first insight into the harms of prison was through the lens of women dying in prison, working closely with Chris Tchaikovsky, an ex-prisoner, an abolitionist, and the founder of Women in Prison. And since the early work that INQUEST did, we've been collaborating with families on deaths of women in prison as a long-standing thematic area of work since our inception. We've documented a pattern of needless deaths across decades in a prison system built to harm and dehumanize, stories of women repeatedly failed and neglected. Our formative book, Dying on the Inside, was published in 2008, analysing patterns of deaths in women's prisons and, importantly, telling the human stories of the women who died, and centering bereaved families' voices and experiences, many of whom had desperately sought help for their relatives and who described women and girls repeatedly failed by multiple state agencies. They also described the impact that the death had and how this rippled through families, children, and community. 10 years later, in 2018, we published Still Dying on the Inside, documenting further deaths. And this latest report, 7 years on, highlights the appalling lack of action from successive governments to tackle the issues that these deaths reveal. Just look at the report of Baroness Jean Corsten, set up in response to the uptrend in deaths in women's prisons, and in particular, the deaths of 6 women in style prison between 2002 and 3. A report that was brought about because of the campaigning of those families. Published in March 2007, it reported on the sadly familiar pattern of deaths. 18 years later, the same structural issues remain. We're still seeing those repeated patterns, the rate and demography of those criminalised and imprisoned largely unchanged. Built to Harm, How Women's Prisons Take Lives, is grounded in government data, INQUEST casework, and interrogates evidence from coroners' inquests. It joins the increasing number of reports condemning as excessive the use of prisons for women. Inquests where families have been legally represented have shone a light on the harmful reality of imprisonment, challenging the state response that often minimises the true violence of prisons, engages in victim blaming to deflect from institutional failure and neglect. Our work has revealed a profound crisis in safety in prison, systemic neglect of women's mental and physical health, overuse and abuse of medication, suicide, self-harm, strip searching, restraint, dehumanising treatment, racism and indifference. It is deplorable that the same issues of concern that were highlighted in those early years in the 80s through Chris Tchaikovsky's work and the continuing work that we've been doing prevail today. The reforms generated, whether dressed up as gender responsiveness or trauma-informed practice, have failed criminalised women and reinforced the legitimacy of prison. Prisons, by their very design, make women more vulnerable to death and harm. Despite endless reports, reviews, recommendations, promises of action, who is sent to prison and why is largely unchanged. Deaths have become normalised. The criminal justice system disproportionately polices, prosecutes and punishes marginalised people, most strongly felt across race, gender, class and disability. Those who have been failed by multiple agencies are gathered up in its carceral net. We see the impact of the criminalisation of poverty, homelessness, mental ill health, drug misuse, abuse, domestic violence. A state criminalising survival strategies such as drug use and sex work, while providing too meagre support when it comes to housing, financial help, mental health services, and gender-based violence. So little has changed. Our public finances continue to be channeled into prisons and policing, rather than into vital community services and a system where people have what they need to thrive in their communities. Prison doesn't fix the problems caused by society, the inequality, the violence, the racism. The structural, social and economic conditions behind why women enter the criminal justice system need to be addressed. The housing, education, employment, income, poverty, addictions, mental and physical ill health, and sexual and physical violence. Why is there always a prison place for a woman, but nowhere for her to live? Our long-standing work in this area leads us once again to reassert our cause for an end to women's imprisonment, to dismantle an institution endlessly exposed for its abject failure, resistant to reform. We need proper investment into radical alternatives that can work with people and centre healing, repair and accountability and reduce victimisation. Prisons disappear people. They are not solutions for social, economic and political ills. We need to be brave and bold and rethink justice, as we know that harm is not healed by more harm. Safety does not come from cages. It comes from communities and connection. Let's invest in women and girls, community, and lives can be transformed. The evidence is all there in the stories of those who've died over decades. Let's use the passion and resources and energy we all have, not least in those who are attending this webinar, whether you're working in the prison or community. Let's work towards meaningful changes that can be sustained. What is certain is that more deaths will follow unless we radically change direction. And I'm now going to hand over to Jess, who's done a brilliant job in pulling together this report and writing it.
Thanks. I think Mo actually was just going to...
That's
Sorry,
great. Thanks, Deb. Just before we hand over to Jess, just to let the people know who are on the call, it's so nice to see everybody. It's been amazing how many people have gotten on this call, but Jess is going to go through the report in what it says, and then we'll come to me and Tanya, Tracy, and Oceana, Kathy, and Sam, who are all family of Kay Melhuish, and we'll have a discussion on some of the findings in the report and what we think needs to happen within this space. But just to acknowledge the amount of people that's on the call, and also the familiar faces, well, familiar names at least. All of you, I'm sure, know lots of this already. And thanks very much to Deb for her rousing introduction. Jess, over to you on the report and its contents. Thanks.
Thank you so much. So yeah, I work here in policy at INQUEST and I authored this report. So I'm going to quickly whiz you through it so that you get a really solid understanding of its main findings. So the report looks at the year 2018 to the present. The reason that we chose 2018 is that that is the year that we published our last report on deaths in women's prisons. And also it's the year in which a major reform, the female offender strategy, was launched by the Ministry of Justice. And since 2018, the government has delivered a raft of reforms in the area of women's prisons. So it's quite a symbolic year. For the report's focus, we're looking obviously at deaths in women's prisons, and we look at 7 deaths in detail in the report. So these include 6 deaths of women and 1 other of a baby. In terms of our methodology, we did a data analysis and a qualitative analysis. So the data analysis uses Ministry of Justice official data on deaths in women's prisons from 2018 to 2024. And then a qualitative analysis, we conduct an analysis of all the reforms made in the area of women's prisons. And also we look at the 7 deaths and look at the cross-cutting issues across those deaths. Next slide, please. Thank you. So these are the 7 people who are included in the report. Some names you may know, some others you may not. And I'll just leave you for a moment to take in those names. So we worked with an amazing designer, Rachel Carr, on the production of this report. And what we decided to do was, as much as the deaths, we want to look at deaths in this report, the lives of those who died inside are also super important. So we reached out to the families of those who had died so that they could paint a picture for us of who they were in life. If you could go to the next slide, please. So what we have done is we've come up with these really beautiful bios of the 7 people, and they tell us little details about them, which, yeah, it's really nice to be given the opportunity to get to know these people. So for Kay, we learned that she was an avid breeder of Cocker Spaniels, and we really like the picture of the dog just underneath. Kay died in 2022, just aged 36 years old. Annalise Sanderson really liked biking and playing football, and those who knew her closer said that she really cherished her relationships. She died at just 18 years old. Thank you very much. So, coming back to the data analysis that I was talking about, from 2018 to 2024, 59 people died in women's prisons. Almost a quarter of these deaths, 14, occurred in HMP style. And this is a very significant finding because a spate of self-inflicted deaths at HMP style triggered the Corson report, which Deb talked about, and that happened in 2007. So basically what this shows is that deaths continue to happen, the same patterns repeat and repeat. The top line of our data analysis is that of the 59 deaths, more than a third, 39%, were self-inflicted deaths. That just shows how prison is an extremely harmful environment, which really exacerbates any harm. Another significant finding of our data analysis is that 12% of deaths were classified as other non-natural deaths, and these can include deaths which are drug-related as well. Next slide, please. Now, coming to our qualitative analysis, we have done, this is just a snippet of the full timeline of reforms made from 2018. So in 2018, you see the female offender strategy was launched, and it had the aim of reducing the women's prison population. What we find, having done this analysis, is that though that strategy wanted to reduce the women's prison population, later reforms are introduced which contradict that. So the MOJ then announced 500 more places for women in prison in 2021. And evaluations done of such reforms, like the female offender strategy, show that the government doesn't deliver on all the measures. So there you can see the government had delivered on less than half of the 65 commitments. So whilst, yeah. The other thing I was going to say about the timeline of reforms is that, you know, consistently new reforms are introduced in the area of women's prisons. At the same time, funding is cut for community-based services. So there you can see in 2024, funding for women's centres is cut, and experts warn that will result in more imprisonment. In 2025, then the Independent Sentencing Review recommended extending punishment into the community through things like electronic tagging. And I'll come back to this in our recommendations, but this expands the scope of punishment beyond prison walls. So it's very complicated, but essentially more and more reforms, at the same time, funding is being cut for community-based services. Thank you. Looking at the 7 deaths, we picked out the 3 key thematic findings. So the first one was not believing prisoners at risk or in crisis. So there were certain points in prison and even before, let's start with prison first, where women would tell prison officers that they had the intent to take their own life. They would pass notes to prison officers. They would be seen to tie ligatures around, I won't go into it, they would be seen to tie ligatures. They were clearly in need of help. Yet what consistently happened is that no action was taken. That's the first one. The other issue that came up is that even when a prisoner's family and other prisoners, even their legal representation, raised issues with their risk of self-harm or suicide, the prison still didn't take action. Coming on to the second point, prison processes consistently malfunctioned in 4 key areas. So emergency cell bells are installed in every cell. Prison policy states that they should be responded to within 5 minutes. However, in our cases, they either weren't responded to at all, as in the case of a woman who was giving birth, or with severe delays. And of course, this can impact on the likelihood of surviving. The second related to the poor oversight of health conditions. So one woman in the report had epilepsy. She had symptoms of having an epileptic seizure, yet was only given paracetamol. And then she died of sudden of a condition related to epilepsy. Another woman had diabetes. The prison knew. The prison also knew about the woman with epilepsy. So the prison knew about this woman's diabetes, but failed to put in place a care plan. The third issue related to the poor signalling of emergency services. So emergency service, there's often a delay in calling emergency services. Obviously that can impact your chances of survival. And the fourth related to lack of adherence to self-harm and suicide prevention guidelines. So as I said, a lot of the women were clearly in obvious distress, had made it clear that they intended to self-harm or take their own life. Yet the procedure known as ACCT in prison, which is supposed to prevent against that, it was not opened across many of the cases. The third and maybe the most significant finding was that imprisonment was the default to social issues. So many of the women were arrested when they were in severe mental health crises. 2 of the women were actually trying to self-harm and take their own life and were arrested at that point. Obviously, they should have been met with care, dignity, and refer to appropriate treatment. Instead, they were punished. They were forcibly removed from their communities and put into prison, where the likelihood of you dying is 10 times higher. Yeah, next slide, please. So the bottom line is that so many reforms have been made in the area of women in prison. They have largely failed, and the reason we know that is because deaths continue to happen. People continue to die in similar circumstances, and at the same time, the funding for community-based services is being cut. So what do we need? The first step is to reduce the prison population. The government continues to invest funding into expanding the prison population, but this is a place that exacerbates harm and contributes to death. The second recommendation relates to departing from punishment. So as I talked about, many of the women who needed care were actually punished. We are concerned about the sentencing bill that's coming through that seeks to punish women in the community as well. We need a radical rethink about how we deal with societal issues like mental health. And the third one is about towards care and dignity. So what we actually need is for the government to invest significant funding into services which enable people to live holistic lives where they're properly supported, where you can easily access drug and alcohol specialist services, where you can access women's centres, refuges. And we believe that had the women in this report received that level of care, then they wouldn't have come into contact with the criminal justice system. I will end my summary there.
Thank you, Jess. Thanks very much. Layla, can I ask you to stop sharing the screen? Thanks a million. So we're joined here today by Tanya Tracy. Hi, Tanya. And Kathy, Oceana, and Sam. Hi, Kathy, Oceana, and Sam. Can I get you to sit forward a little bit? And it's been great to hear from Deb about the context and the kind of history of INQUEST work in this area, and also Jess around the contents of the report. But we know reports are one thing, and living and life and going through your contact with prisons or the death of a loved one in prison is a whole other ballgame. So thank you for joining us today. I just want to say before we begin our conversation that if you have any questions for us, there is a Q&A function. If you could use that, we'd really appreciate it, because it just helps keep everything a little more filtered. Tanya, do you want to just introduce yourself briefly?
Yes, of course. So I'm Tanya, and it's really good to be here to discuss such an important topic. So I'm currently Criminal Justice Services Manager at Birth Companions, an organisation that supports women during the 1001 days who experience multiple unmet needs and disadvantage. And I currently oversee the services that we deliver for mothers and pregnant women in prisons. I am soon to be Director of Services at Birth Companions, which is great, where I can continue the work in the community as well. But I'm also here because I have my own lived experience of being in prison as a young person. And so, yeah, I wanted to contribute to the discussion.
Thank you, Tanya. And Tanya and I used to work for an organisation called Women in Prison that was mentioned at the start because Chris Tchaikovsky started it. And I recognise some of the faces, some of the names, as I said, of people joining us today. And we have some people working at Women in Prison right now joining the call, which we're very pleased with. Kathy, Oceana, and Sam, I'm only going in that order because that's how I see you on the screen. Do you want to introduce yourselves?
Hi, I'm Oceana. I am Kay Melhuish's daughter.
Hi, I'm Kathy, and I'm Kay Melhuish's best friend.
Hi, I'm Sam, and I'm another good friend of Kay.
Thank you all so much for joining us today. And it's been great getting to know you over the last few weeks in terms of preparing for today's webinar. So I'm just going to open up our discussion with a question for you all. Do any of the recommendations included in the report speak to you, and why this might be? Oceana, can I come to you first?
Yeah, they do really speak to me. I think that they bring up very good, valid points. I think that they are the main points to be looked at as a whole, and they are the ones that definitely need to be changed.
Thank you. And I'm just going to go back off the screen to Tanya and then come back to you, Kathy and Sam, okay? Tanya, any of the recommendations speak to you?
Yeah. I mean, I agree with Oceana that, you know, all the points raised are valid and so important. And I mean, there's a few things really, and I know Deb has spoken to this at the beginning, but addressing the unmet needs of women should be a priority, because the reason why women end up in contact with the criminal justice system is because their needs are not being met. And I guess there's something about, I don't know, punishment is the solution to women's unmet needs, when actually there should be more of a holistic approach. And when I was like, you know, going through the report and just thinking about why is the focus on punishment, and why can't the focus be on diverting women away from the criminal justice system altogether? Because it shouldn't just be about let's not send women to prison. Absolutely not. Prison is so unsafe. It's so harmful. It should not be a solution. However, criminalizing women should not be a solution either. And so thinking more, I guess, if this is more radical, though it feels like it makes sense to me, but if this is a more radical approach, why don't we look at diverting women away into services that can better support their needs, that can address the unmet needs, the unmet mental health needs, the issues around poverty, housing. You know, we know that women who end up in contact with the criminal justice system and in prison are survivors of domestic abuse, are survivors of childhood abuse. We know Black women are disproportionately overrepresented in prison. We know that pregnant women are unsafe. We know that babies die in prison. It doesn't seem like that should be ever be a solution, and instead investment needs to go into community services that are always better placed to support women and their needs and their children as well. You know, like women don't just exist on their own. They're a part of a family, a part of a community that contributes so much. And to remove a woman and place her in an unsafe environment where the stakes are so high, where she potentially can come to so much harm and pass away, it's tragic. So I feel like those are the things that really spoke quite loudly to me.
Thanks so much, Tanya. And back to Oceana and Kathy and Sam. Some of the things Tanya said there really reminded me of our conversation about your experiences of the support your mum didn't get and her being sent to prison. Is there anything in that Tanya said that you'd like to respond to or pick up on?
I completely agree with Tanya. It's just a big failure in general. Like with mum, she was definitely not meant to be there. Her mental health was not good. It was not the right place for her. They couldn't provide the support. They couldn't provide to her needs, especially being neurodivergent. It just wasn't accommodating whatsoever, and they did nothing to accommodate. And there's going to be other women like mum that, you know, shouldn't be there, that have those diversities or is mentally unwell, and they won't get the help either. And it's just going to increase deaths, it's going to increase self-inflicted harm. It's just overall not a place that you send women that have gone through things to end up the way they are.
Also, the whole time that Kay was in the prison, her phone was never activated. She only got 2 compassionate calls the whole time with a prison officer next to her. So it's such a big problem for women to be able to keep contact.
Yeah, and we hear that importance of contact with family all the time, don't we? But then we also, well, from the inquest side of things, we hear families say they've tried to reach out, they've tried to raise the alarm with prison, they've tried to explain the needs of their loved ones. Sam, Tanya was talking about the impact on the family and friend, well, family and friends, and we, you know, we at Inquest think of family not just as people you're related to, but the people that are in your lives, you know. Did any of that resonate with you in terms of when Kay was sent to prison?
Well, yeah, like I say, it's just reiterating the importance of, like, if they'd have nurtured her mental health and understood the importance of that, then she wouldn't have been there in the first place. And she was the type of person that helped everybody with their mental health, and then she was just completely and utterly failed when she needed the help herself. And yeah, it's something needs to change, because like Oshi said, there's so many more women still in the same position that just need saving, and then they're turning a blind eye, and they can't do it anymore.
Whereas Kay wasn't convicted, Kay was only on remand because they didn't know what to do with her. So people need to be aware of what they're sending these women to, especially mentally unwell women that are in crisis.
Yeah, because the report comes to the conclusion that many of the women who died in prison shouldn't have been in prison in the first place. And I get a sense from everyone on the call that that really resonates. But something, Kathy, you said you wanted to highlight is that sentencers need to know what they're sentencing them to. And
absolutely.
One of the things we also hear is people that, you know, sentencers thought it was a place of safety or that they'd get care. But you said something to me on Friday, which is really interesting, about the mental health support local to your area.
Yeah.
Do you want to go into that a little bit?
We've got literally 2 minutes up the road, we've got a mental health hospital there. They discharged Kay during a sectioning, and that's how Kay ended up being in the prison system, because she didn't have any support, even though it's only 2 minutes up the road from us, you know.
So you can see the 2 different institutions, one so close to home and one presumably geared towards providing support rather than punishment, and yet the sentencers continue to sentence women.
They did.
And remand has been a very long-standing issue for women's prison, as well as for deaths in prison, and unfortunately we've seen an increase as of late on deaths in remand prisoners. I just wanted to ask another question. So this report highlights that despite the best efforts of many people, many of whom were on the call, even more, over the very many years, reforms made on women's prisons have ultimately failed to protect women in prison from harm and from preventable deaths. And I think there's something that's so hard when a death is preventable. It's so difficult to kind of consolidate, you know. Where does that sit with you in terms of all of the work that people have tried over the very many years, and it's still not affecting change?
I mean, you can put rules and regulations in place. It's whether they get followed inside the prison. You know, a lot of it was just dismissed with Mum. Her ACT reports weren't done. They weren't even recorded, any like incidents she had. You know, like I said, you can put all these in place, but whether they actually get followed is what could make them work. But we don't know, because they aren't followed, and there's no actual evidence that they are followed, or if it's even worked.
Kay's ACT was managed by the quality assessor for ACTs, and it's still left blank.
Yeah, the ACT process is something that's come up an awful lot in the work we do. Tanya, how do you feel about that question in terms of the years of efforts to reform the prison, particularly in the area you're working in now with birth companions? There's been huge strides, and again more recently a big focus on the health of pregnant people and mothers in prison. In light of baby Aisha Cleary, who's in this report, Steph, and the other baby who died in Soil. Can you tell us a little bit about that?
Yeah, I mean, reform doesn't. We know reform doesn't work, because I mean, I've been working in this space for, I don't know, close to 20 years, and so I've been in spaces where we've been discussing this for all that time. And it just doesn't seem like much is changing. So no matter what's introduced, not only are people not following guidance or policy, it just does not, it's because it doesn't work. Because even when people are following guidance and policy, women are still coming to harm. I mean, from a birth companion's perspective, and my personal, perspective as well, is that pregnant women, mothers to infants, should just not be in prison. It's not a safe place. It could never be a safe place. There is an expectation that they would receive equivalents of care like they would in a community. Well, we know that doesn't happen. It's incapable of being the same as in the community, because if a pregnant woman is locked behind her door, she cannot walk out and call for help if she is in labour. And even if she is in labour and she calls her bell, it's not answered. And we saw that with Rihanna Cleary, and that's why she gave birth and Aisha Cleary died. Nobody responded to her bell. In 2002, I was calling my bell and no one responded. My baby wasn't ready to come, but had he been ready to come, I don't know what the outcome will be. So that was over 20 years ago, and still it's the same thing. I don't think reform is the answer. It's not the answer. It's not a safe environment. It's women anyway need care. They need compassion. They need kindness. They have the reason they end up in prison is what needs to be reformed. Things need to change to prevent women from going into prison in the first place, not reform the very place that's causing women harm. So yeah, it feels like we've given it a go, reform, and we can't keep doing the same thing and expecting a different result.
Some might say reform has been running alongside prison for its whole project. The current prison system we have is in itself a reformist inception of prisons. But yeah, I think it's a really interesting, especially when you're on the ground trying to do the work, and having those relationships with prison and managing that kind of constant tension between delivering services in and working with the system. And then, I've been involved in training in prisons and doing training of probation officers. But as you said, unless the people are stopped being sent to prison, unless we stop the flow of prisoners, which the prison has no control over, which goes back to Kathy's point, sentencers. Kathy, you raised you'd like them to know what it is they're sentencing people to. If you had a message to give a sentencer now about Kay's experience and your experience, what would you say?
If they hadn't done it that day, she would be alive, because she told them that's what she was going to do, and she did it.
Yeah, that's very powerful, isn't it? Especially in this week of 16 days of activism, when one of the refrains is believe women, and one of the recurring themes in our work with the families of those who died in prisons is women are not being believed. Their healthcare needs are not being believed. Their calls for help are not being believed. And I was so struck when you told me about how many times Kay tried to to advocate for herself,
Mhm.
and wasn't believed. So I'm just going to take a few questions in the question and answer little segment, if that's okay. And there's a few. I'm going to chunk a few of them up because they relate to consequences for prisons in terms of process and regulations and civil legal actions and where they might pay compensation. And they're technical questions for the inquest team for sure. But I'm going to just frame it as accountability and the importance of accountability for you. And I guess just to kind of pose, Kay was held very accountable for her actions, right? And she was sent to prison. How do you think that fits with the level of accountability the prisons have for when harm happens in their establishment, in your experience?
They don't have any accountability.
No, they just pass the buck, blame somebody else, blame the process. And they just didn't show any care or compassion towards anything, and they couldn't admit any mistake.
The inquest was horrific. We had
Can you
60.
tell us a little bit about that, please? Because
Well-
it's not going to be a process familiar to a lot of the people on the call, I think.
It was a month long, and we had so many witnesses, and all the prison staff just said that they couldn't remember anything.
Is that they didn't know, or
Yeah,
you know, they weren't told, or you know, anything, and they didn't show one bit of remorse or compassion. You know, we were sat there for someone that was no longer with us, and they just didn't care. You know, they were,
She's treated more as a prison number than a person.
yeah.
yeah. You know, so a lot of people said they didn't even remember her, when you
Wow.
know they did.
Yeah. It's hard to not remember someone that's died in your care, isn't it?
Yeah.
Yeah.
Yeah. Tanya, can I come to you on the question of accountability? If you have any thoughts on that area.
I mean, it's difficult, isn't it? Because we know prisons are also stretched and under-resourced, and staffing levels are low because of staff trying to attend to their own mental health. They are not equipped with the right tools to manage a lot of the situations the women are in, and so it's really difficult. But ultimately, staff need to respond to the needs of women who are in crisis, who are calling for help. I mean, what the family just said previously around, things was not documented in the ACT book, or ACT recommendations weren't being followed. Calls for help, for a bell, or verbally sharing how someone's feeling and not being taken seriously. So that ultimately the prison have to be accountable for that, and how they respond to that, whether that's better training and getting services in that are more appropriate. But that's just putting a plaster, isn't it? Because ultimately, if prisons weren't operating in the way that they do at the moment, and if they didn't exist in the way that they do, and women weren't there in the first place, that didn't need to be there, then we wouldn't be having those questions. So it's almost like the accountability needs to go up a bit more, up the chain, to people, the decision makers that are continuing to send women to prison, whether that be those that are in charge of sentencing, or those that are in charge of writing policy and guidance, and government, those in power that are signing these, allowing this to continue.
Thanks, Tanya. We just had a question in the chat about what is an ACT, and I'm just gonna read out the acronym But basically, it's a process in the prison where if someone is at risk of self-harm or suicide, that they're put on this kind of monitoring system that's supposed to be across the whole prison estate, not just prison officers, but anyone that the prisoner comes in contact to. And it stands for Assessment, Care in Custody and Teamwork. And the policy has been reviewed relatively recently, but you'll see in the questions and answers there, Kirsty Kitchen, who's also from Birth Companions, says it raises a lot of issues. And there's been recent reports, research between Laura Abbott and Birth Companions around acts and what happens when mothers are separated from their babies. It's a crucial time. I know you wanted to mention that key time, Tanya, in relation to a woman. Do you want to just say a few words?
No, I was just reminded of I know this one wasn't included in your report, but Michelle Barnes in 2015, who also died by suicide after being separated from her baby, and so after giving birth. So it's just like these are the circumstances that exacerbate a woman's mental health and puts her more at risk of suicide. And I think these are. We have to remember all of these kind of situations and circumstances which make prison even more difficult for someone to live through and stay in. And Oceana's mentioned that, that it exacerbates, someone's mental health. And sadly, a woman who just gave birth, also died by suicide.
It's a difficult time. And that, those key periods of vulnerability, like remand, Oceana's mum was on remand, and not in prison for a very long time at all, but they're very key flashpoints. And hard to know after all of the years of working on trying to make them safer, if, as you say, it's possible to make these key crunch points safer, or if it's just better not to have people in that setting to begin with. We're coming up to about 5 minutes to the end of the call. We'll be finished at 2. And before I go through my next things INQUEST have coming up, I want to see if Kathy, Oceana, and Sam, if you have anything you want to say, you don't want to leave the call without saying.
Is that just, it does obviously start from the community, but it seems like prison is the end result, and it shouldn't be an end result. It shouldn't be there. Again, a lot of these women are mentally unwell, they neurodiverse. It's just not a place that people should be. They should be cared for, looked after, given the right help and support, and not just chucked and forgotten about. My mum was only in there for 19 days until she took her own life. And, that is a short time, but obviously enough time to done some damage to her.
The neglect was phenomenal that she experienced in those 19 days.
Thank you. There's a lot of damage, wasn't it?
Mm-hmm.
Yeah. And now it's something that everyone has to live with, and I don't think people understand that either.
We don't.
No.
Thank you all so much for coming on the call. Tanya, is there anything you wanted to say before we start wrapping up?
I mean, just that topic of remand as well. Honestly, it just feels, just so unnecessary that a woman hasn't even been convicted and she's in such a harmful environment that led to her death. It's such a tragedy that remand is being used as, I don't know, as some kind of halfway help, for women, when actually all it's doing is severely harming women. But I think my takeaway is, this topic just makes me so angry. I just think, we should all just be angry here and really, really peed off about it. It's just tragic that we're even continuing to discuss this, and so many women have died in that time frame that we're speaking about. But it was just something about healing over punishment that just feels so important, you know. Just that's what women need. They need healing over punishment, and that should be the kind of what the aim is. Yeah.
Thanks, Tanya. There is that very famous Chris Tchaikovsky quote around about a woman being sent to prison and who's experienced punishment all her life, and more punishment isn't going to be the thing that brings about the change. Before we finish up, thanks to everyone who's called. It is very who's joined us. It is very saddening and angry inducing, but sometimes anger can be energizing. And INQUEST are kind of fueled off that half the time. So thank you for the people who said it's a really timely time for this report to be launched. We think so too. We really would like the report to be spread far and wide, and for you to help us to do that. On Wednesday, it will be officially launched, and we'll send you copies. And please do use it. It's not just for us, it's for people making the case that women shouldn't be sent to prisons, to use this report and use it as evidence that now we can't do more of the same. And the one thing that we have learned, unfortunately, so strongly at INQUEST is we see the repeated deaths of women in the same circumstances time and time again, and some of them there's hardly a cigarette paper between the difference in their deaths. So just before we go, I want to let you know that INQUEST are doing the big give. Quick, Layla. INQUEST have, we're very busy at INQUEST at the minute. I've slightly lost my mind with the busyness. But next week we're opening an exhibition on our archive. You'll see some of the archive footage has featured in the report. And we're launching it on Tuesday. Please contact us if you'd like to come to Hammersmith. And then we have some programmed events online. Between Action and the Archive is on Wednesday the 10th. Film as Memorial is on Tuesday, the following Tuesday. And on Saturday we have a lovely herbs and healing workshop, because healing is so important and warmth in the winter is so important. So please do look at our preventable, which is such a key thing for us to say about these deaths, exhibition. And then Layla, our next slide, INQUEST are a charity, and we are going to do our charity begging here, please. So we're doing the big give tomorrow. All your donations will be doubled. Why would you not donate during this season for the Christmas challenge? Please do. We're running it for a week. If you can't donate, and we understand not everyone can, we would ask you to please share and say why you think we are an important organization to donate to, and you can maybe say you came to this webinar. So that is on the 2nd to the 9th of December. And thank you so much for everyone who's joined us. We were really honored to have such a high number of people joining the webinar, but we do know that that just shows how many people are committed to this area of work, and to see change change effected for the women impacted by imprisonment and their families. Thank you. Bye.
Thank you.
Bye.
Bye.